Hello, my name is Melissa Pincay. I am going to talk about clinical assessment of peripheral arterial disease of the lower limbs. Definition: peripheral arterial disease is chronic arterial occlusive disease of the lower extremity caused by arteriosclerosis. The peripheral arterial disease may cause intermittent claudication, which is pain or weakness with walking that is relieved with rest. The muscle pain or weakness after exercise occurs distal to the arterial obstruction.
Up to 16% of people over the age of 55 suffer from peripheral artery disease, or PAD. Risk factors for the condition include diabetes, smoking, older age, and atherosclerosis in any arterial blood vessel. PAD is a progressive condition caused by the formation of atherosclerotic plaques in the peripheral arteries, reducing blood flow and, in some cases, causing pain. The rupture of one of these plaques triggers platelet activation and factor Xa-mediated thrombin generation, leading to the formation of a blood clot, a process known as atherothrombosis. This further limits, or may even completely block, blood flow through the artery, causing symptoms to worsen. Vascular obstruction may cause limb ischemia, which, in the most severe cases, can lead to limb amputation. Importantly, PAD is frequently asymptomatic. More than half of patients undergoing major amputation for critical limb ischemia may have had no symptoms of ischemia as little as 6 months earlier. In some high-risk cases, revascularization is recommended to relieve the ischemia. This involves using a stent to manually widen the artery and restore blood flow. Over 60% of patients with PAD also have atherosclerotic plaques in the coronary arteries of the heart or in the arteries supplying oxygen to the brain. Patients with PAD are therefore not only at risk of critical limb ischemia, but also of other thrombotic events, such as myocardial infarction or stroke. Arterial blood clots are rich in platelets. Guidelines recommend that patients with PAD receive antiplatelet agents and make certain lifestyle changes to reduce their atherothrombotic risk. Despite this, patients remain at high risk of thrombotic events. In one clinical trial, nearly 1 in 10 patients with previous PAD had a myocardial infarction, stroke, or died of cardiovascular causes, despite receiving acetylsalicylic acid. To further reduce this risk, clinical trials are investigating optimal treatment strategies in patients with acute limb ischemia or stable PAD. The results of these studies hold great interest for physicians and patients alike.
Application is nursing. The application is nursing while focus on the review of nursing care that can be offered to patients with vascular ulcers in the lower limbs due to peripheral arterial disease, but in order to contribute to improvement and recovery of injury and to extend the health education of patients so that they can improve their lifestyle and thus reduce the risk of surgery from such disease.
Okay, in the next 2 videos, we are going to talk about peripheral arterial disease as well as peripheral venous disorders. So it's really important to understand the difference. With peripheral arterial disease, we are having trouble getting blood flow into the legs, okay? With peripheral venous disorders, we are getting blood flow into the legs, but it can't get back up to the heart. So again, the arteries are the problem when we're getting down to the legs, and the veins are the problem when we're trying to get that blood back up to the heart. So in this video, we're going to talk about peripheral arterial disease. So that is an issue with the arteries and an issue with getting blood flow to the legs. So the main cause of peripheral arterial disease is atherosclerosis, okay? And then there are a number of risk factors that place an individual at higher risk for peripheral arterial disease. So these risk factors include hypertension, diabetes, smoking, obesity, and hyperlipidemia. Important to know those risk factors. And then symptoms are also super important to understand and to be able to differentiate between peripheral arterial disease symptoms and peripheral venous disorder signs and symptoms. So with PAD, we have symptoms such as pain in the legs during exercise that is relieved when the individual places their legs in a dependent position. So this means like they're dangling them over like the side of the bed. So when they're walking, they'll get that pain in their legs, and if they sit down and kind of dangle their legs, it will feel better for them. Also, you will notice decreased capillary refill in the toes. You will notice decreased pedal pulses. Lack of hair on the calves is a hallmark symptom of PAD. In addition, the patient may have thick toenails and pallor with elevation and dependent rubor. So meaning if you elevate their legs, they'll be pale, and when they dangle them off the side of the bed, so in a dependent position, then they will be red, okay?
Pros and cons. Pros. The pros is that it will be possible to manage patients which should initiate supervised exercise programs to improve functional status and quality of life, in addition to preventing the reduction of symptoms in those patients. Lipid profile, blood pressure, and glycemia should be kept under control. Cons. The cons is muscle pain or weakness after exercise that occurs distal to the arterial obstruction, since the superficial femoral and popliteal arteries are most commonly affected by arteriosclerosis. The pain of intermittent claudication is most often localized to the calf. Arteriosclerosis obstruction of the distal aorta and its bifurcation in the two iliac arteries can cause pain in the buttocks, hips, thighs, on the lower back muscle, as well as in the pelvis.
Peripheral artery disease, PAD, is a common circulatory condition in which peripheral arteries are narrowed, reducing blood flow. While PAD can occur in any organ or body part, the lower limbs are the most commonly affected. The major cause of PAD is the building up of plaques in arteries, known as atherosclerosis. Plaques are deposits of lipids, fibrous tissue, and calcium that accumulate slowly over time. Less commonly, an artery may suddenly be blocked by a blood clot or embolus. Rarer causes include blood vessel inflammation, injury, or unusual anatomy of ligaments or muscles. The impact of reduced blood flow, or ischemia, is most remarkable when there is a higher demand for blood supply, such as during physical activities. This is why people who are not very active may not experience any symptoms initially. It also explains the most telltale sign of PAD, known as intermittent claudication, a painful or tired feeling in the legs that occurs while walking, but is rapidly relieved by rest. The affected leg and foot may lose color and feel cold, especially when the foot is elevated. There may also be a lack of growth of toenails and hair. The location of pain depends on the site of obstruction. The more proximal the site of blockage, the more widespread the pain. The calf is the most common site of pain. As the disease progresses, patients may experience pain even during rest. This advanced stage is known as critical limb ischemia, a chronic, slow-developing condition. Patients may develop ulcers that heal slowly or not at all, and death of tissue or gangrene may occur. The risk for loss of limb is significantly increased at this stage. Acute limb ischemia happens when there is a sudden block of blood flow, typically due to an embolism or thrombosis. Acute limb ischemia is an emergency threatening loss of limb. Any factors that increase risks for atherosclerosis also increase risks for PAD. Because atherosclerosis can affect any artery in the body, PAD patients are also likely to have coronary artery disease or carotid artery disease. Diagnosis is based on symptoms, medical history, physical exam, and a number of tests. The purpose of the physical exam is to look for signs such as weak pulses, whooshing sounds of obstructed blood flow, and evidence of poor wound healing. Blood tests are done to evaluate cholesterol, triglyceride, and blood sugar levels. Ankle brachial index test, or ABI test, is commonly performed to compare blood pressures in the ankle and the arm. An ABI lower than 0.9 indicates PAD. Imaging procedures may be performed to identify the affected arteries. Treatments aim to relieve symptoms, re-establish blood flow to reduce risk of losing a limb, and stop progression of atherosclerosis to lower risk of heart attack and strokes. Treatment options include lifestyle changes, exercise programs, medications, and/or procedures to open or bypass blockages in the arteries.
Issue applied in Ecuador. In Ecuador, in a study carried out in 254 diabetic patients attended a health center in the urban area of Cuenca, it was estimated that the prevalence of peripheral arterial disease was 47.2%, in the cardiac insufficiency 95%, 41.1%, and 53.3%. Conclusion: the peripheral arterial disease can lead to disabling symptoms and may indicate more widespread cardiovascular disease that both people at risk of stroke and heart disease. This guideline provides clear recommendation on reducing the risk of future circulatory problems and on accurate diagnosis and treatment of the disease in the legs. The importance of particularly the benefits of exercise and supervised exercise programs. Thank you very much.